Mr. Speaker, Canada's healthcare system is broken. 6.5 million Canadians don't have access to a family doctor. We are short at least 23,000 doctors and 60,000 registered nurses. Emergency rooms are closing across the country. Healthcare workers are burnt out from millions of hours of overtime. And Canadians are literally dying waiting for care. Canada's healthcare system is broken. And instead of repairing the cracks, the Liberals took a hammer to the glass. I'm going to warn Canadians, health care in Canada is only going to get worse under this government. Mark my words. Why? Because the Liberals are reducing the capacity of doctors and nurses while at the same time increasing the demand for care. Let's start with capacity. According to the College of Physicians and Surgeons of Canada, there are at least 13,000 internationally trained physicians already in Canada who are not working as doctors. And according to the Health Minister's own department, there are 80,000 internationally trained healthcare professionals in Canada right now who are not working in their field. You think about that. Tens of thousands of doctors, nurses, and specialists are here, trained, qualified, and ready to serve. But they're shut out by a wall of bureaucracy. The reason is simple. Government gatekeepers and licensing bodies are blocking these qualified professionals from getting their licenses. The Immigration Department fast-tracks international doctors and nurses into this country, but then abandons them when they arrive. The Liberals have failed to establish a national competency standard to recognize their credentials. So they get stuck, trapped between provincial regulators and federal inaction. As a result, we have doctors driving taxis and working in factories while hospitals close emergency rooms and patients die waiting for care. The government sold these professionals a false bill of goods, and Canadians are paying the price. This bottleneck is only getting worse because the Liberals keep adding more people into a broken system without helping the people that are already here, Mr. Speaker. Another major barrier is that a doctor licensed in one province can't automatically work in another province. Now you think about that. A doctor who is fully licensed in one province cannot simply move to another and start working without mountains of paperwork, costs, and months of delay. If the federal government truly believed in one Canada economy, it would have introduced a national license for doctors and nurses, allowing them to work anywhere in the country. Earlier this month, Canadians were briefly optimistic when the health minister told the Globe and Mail that she planned to introduce legislation to remove interprovincial barriers for health professionals. But that hope was short-lived. Within hours, her office reversed course, claiming the minister misunderstood the question. Mr. Speaker, the minister seems to misunderstand a lot of questions when it comes to the healthcare system. Another issue is shortage of residency training spots in Canada. Every year, hundreds of Canadians graduate medical schools abroad, but they can't get a residency placement in their own country. Why? Because the federal immigration minister keeps issuing work permits to federal foreign-sponsored medical trainees, people who come here from foreign countries to train in our hospitals only to return home afterward. Countries around the world send their citizens to Canadian hospitals for training. In fact, according to data from the Canadian Post-MD Education Registry, Saudi Arabia alone sent over 1,000 trainees to Canada last year. Almost all of them will never work a single day in Canada after the training is complete. Meanwhile, Canadian citizens who studied medicine overseas, often because there weren't enough medical school seats in Canada, are told there's no capacity for them. Why is the federal immigration minister issuing work permits for Saudi students to train in our hospitals when there are not enough training spots for Canadians? Mr. Speaker, The Liberals like to claim that our record of immigration levels will somehow fix our healthcare system. But that's not what's happening. Thousands of qualified foreign-trained doctors are already here and can't work. Thousands of Canadian citizens who trained abroad can't get trained. You can't fix a traffic jam by adding more cars to the road. And that's exactly what the Liberals are doing. Mr. Speaker, now let's look at the other side of the equation, demand. This year alone, the Liberals plan to allow 395,000 new permanent residents and 673 non-permanent residents into Canada. That's over 1 million people added to a healthcare system that already can't keep up. It doesn't take an economist to understand that adding a record amount of people into our country will have an impact on healthcare. And here's the real scandal. According to the Health Canada, the Liberals have done no analysis, none whatsoever, and on the impact that record immigration levels will have on our healthcare system. Even the health minister admitted this insanity when she said, and I quote, "Right now, there's no alignment on immigration and the need for doctors," end quote. To make matters worse, Canadians were outraged to learn that the Immigration Department has been advertising Canada's free healthcare around the world as a selling point to attract more newcomers. Mr. Speaker, Canada is not a walk-in clinic for the rest of the world. Compassion must consider capacity.